Louise from We Are Medics, and I'm now going to be talking about the decision-making section of the UCAT. Decision-making section of the UCAT is looking at your ability to logically use your reasoning to work out different text-based and also visual-based questions, and that's highly relevant and transferable to the clinical setting in medicine when you will have to be making lots of decisions under time pressure. So it's essentially what this section is trying to test you on. So the basic format of this section is that there'll be 29 questions to answer in 31 minutes. So that works out as about 1 minute per question. So you do need to work through them quite quickly, as in the whole UCAT. And generally each question there'll be different formats. So you can either answer a multiple choice question, so you'll be given 4 statements and there's just one correct answer that you need to select. And you can also be given a question where there'll be 5 statements and then you have to drag and drop yes or no to each statement for all 5 of them to answer that question. During this section you will have access to the whiteboard, which is there for a reason. So if you're someone who works well visualising different information and wants to write some of their working out down, then we do encourage you to use it and give online whiteboards that are free on resources online a go to practice using that. And there will also be access to the basic on-screen calculator for some of the more maths-based questions in this section. So there are 6 major types of questions in this section of the UCAT. So it's the most diverse and maybe complex out of all the different sections, but don't worry, we'll talk you through each section individually. And so these different question types will come up in the format that I described earlier, between multiple choice and then also yes or no which drag and drop to the statements that they provide. Question types that can come up are logical puzzles, syllogisms, interpreting information, recognising assumptions, using Venn diagrams, and probability reasoning. So starting out with logical puzzles. So in this question, you'll be presented with some information either in text, table or a graph, and then be expected to select the correct conclusion based on this. So some tips that we have is try and eliminate any answers that are definitely wrong to start with. Don't waste time kind of trying to work them out if you can immediately pick them up as not correct. Do look out for words such as must or might in the answers. And also don't waste time doing any working out that you don't need to. So again, going back to if you can see a statement that's obviously not correct, don't spend time trying to check on it and work it out. Move on to the next one and try and answer within that minute. So the second type of question you can get, they're called syllogisms. So essentially you'll be given a series of statements in about 2 or 3 sentences, and then you'll be given 5 different conclusions. And next to each conclusion you need to drag and drop yes next to that conclusion, whether or not it's true or not, based on the information that you've been given. So some tips we have are don't make any assumptions and make sure that you're only saying yes to stuff that's been explicitly mentioned in the statements that you're given, and don't rush through reading the statements that you are given. Don't be afraid to reread information just to check before you drag and drop that yes or no. And the third type of question is called interpreting information. So essentially you'll be given some information either in the form of a text, chart or graph or a picture, diagram, that kind of thing. And then you'll be given 5 different statements that again you need to drag and drop yes or no depending on whether they're true or not. And a bit similar to the previous question type, you need to make sure that you're, again, not going in with any assumptions. Some of the statements they give you may be plausible using your everyday knowledge, but aren't explicitly mentioned in the information they give you. So make sure that you're checking and rereading, and it's only stuff that's been explicitly mentioned that you're marking as yes. So next up is recognising assumptions. So this is testing your ability to assess the strengths of solutions to an issue that you've been given. So what will happen is you'll be given a sort of issue, for example, the example I'm going to give today is whether or not doctors in the NHS should be wearing uniforms. And so then you'll be given 4 different arguments for why, for and against this issue. And then it's up to you to decide which is the strongest argument. So this sometimes can be a bit more difficult because it can seem a bit more interpretive. But essentially there's some things that you can go along with to get the right answer. So strong arguments are generally those that are based on fact. They don't make assumptions and they directly link to the problem at hand and the solution. whereas weaker arguments are just the reverse. So those that make assumptions, they might have might or kind of more questions in the language they use, and they're a bit more based on kind of feelings or, again, assumptions, as I said. So the next section is all about Venn diagrams. So in your practice you'll definitely be getting very used to looking at these, so don't worry about it when you're starting out. Essentially, you'll either be given a Venn diagram and then a list of 4 different conclusions to make from that Venn diagram, and you've just got to select the one correct answer. Or you can be then given some information in text and then presented with 4 different Venn diagrams, and again you have to select the one correct Venn diagram as your answer. So definitely, as I've said, in your practice you'll be getting used to viewing Venn diagrams. Don't be put off if they're lots of different weird funky shapes and there are lots of overlap. You've just got to get used to seeing that, and when you're working through each statement that they give you, you can then just look at the relevant bits of the Venn diagram to help you work out whether that's right or wrong. And other tips we can give is remember that you might not need all the information that they give you, so some parts of that Venn diagram you're not going to have to look at all. So as I said, just kind of focus your attention on what the statement's saying, refer to the Venn diagram, and then mark it as yes or mark it as no and move on to the next statement. And the last type of question you can get is probabilistic reasoning, bit of a mouthful, but essentially you'll be given a short passage that involves statistical information, which will usually be probability-based questions. So do be familiar with working with probability and those type of topics which will come up in school, and be ready and refresh that in your preparation. This will generally involve also decimals and fractions and percentages, so get used to seeing those as well. So we've got one worked example that I'll talk through today. So it's the making and recognising assumptions type of question. So as I said earlier, you'll be given an issue that's at hand and a solution, and then you'll be given 4 different arguments for why this should be implemented, and then you need to select one correct answer out of all 4, which is the strongest argument. So the example we've got here is, to improve productivity, should the NHS make uniforms for all doctors? Select the strongest argument from the statements below. So number 1, yes, as it might help motivate and put staff into a mindset of working. 2, yes, as surgeons already wear scrubs as uniforms. 3, no, as administrators feel it would be difficult to monitor and enforce. And number 4, no, as it has been shown to be limited benefit. So you've got 4 different arguments that, all have a varying difference of validity behind them. And essentially, as I said before, we need to look at what arguments are strong and what are weak. So stronger arguments, as I said, they're based on fact, they don't make assumptions, and crucially, they directly link to the issue that you've been given. So in this example, things that aren't quite as relevant is number 2, which was, yes, as surgeons already wear scrubs as uniforms. That's not quite as relevant, particularly when in the question it's asked, should the NHS make uniforms for all doctors? And surgeons aren't all doctors, obviously. And again, something that's perhaps a little bit less relevant as well is, no, as administrators feel it would be difficult to monitor and enforce. Also, that adds a layer of a bit of opinion and assumption, so look out for words like feel. So that says administrators feel it would be difficult, and that's not actual fact, so that would be a weaker argument. And also number 1 is a bit based on assumptions and not direct fact, because it says, yes, as it might help motivate and put staff into a mindset of working. That keyword might is something that should ring alarm bells and make you think this isn't the correct answer. So the correct answer in this question would be no. The NHS shouldn't make uniforms for all doctors, as it has been shown to be limited benefit. So that's a strong argument because it's based on fact, there's no assumption or feelings involved, and it's provided evidence saying it's been shown to be limited benefit, which would be the strongest argument in this case. So here's a rundown of some of the tips that we have for you when you're attempting the decision-making section of the UCAT. As we've covered, there are quite a few different types of questions, there's 6 in total, but the biggest advice we can give is just to practice. Once you get familiar with these different question types, you'll recognise recurring templates, and that some of the questions will just be the same, but they'll change some of the wording around. So once you get used to seeing them, that will mean that you can be quicker at answering questions and not be thrown by unfamiliar ones. In particular, those would be stuff like Venn diagrams and also identifying assumptions from statements that they give. In the case with a lot of the UCAT, these questions can be quite time pressured, particularly those where you're drag and dropping yes or no to 5 different conclusions. So our advice would be start practicing getting familiar with these different questions without a time limit. And once you feel more confident and you recognise all 6 different types of questions, then have a go at practicing under time pressure. And so a common pitfall can be spending too long on one question, and that means that you don't actually finish the whole section. So if realistically you think, I'm not going to be able to answer this question and figure it out within a minute, 2 minutes, take a guess, an educated one if possible, and move on, and you might be able to come back if you flag it, the question to come back to later. As I've also said, the probability type questions can involve math skills that you learn at GCSE, including probability, Venn diagrams and percentages. So make sure you refresh your knowledge in this and get used to using these again, particularly if you're not studying maths currently after GCSE. And similarly on that line, some of the questions may involve statistics, so do get used to interpreting graphs and tables, and this is stuff that does come up at GCSE and A-level biology or maths, so don't worry, you can look back at some of the work that you've done previously and get familiar with that. And a big thing about a lot of this, particularly those that you're making conclusions, you're identifying assumptions, it's about reading the wording very carefully. In our example earlier, just one word made you realise, okay, that's more of an opinion, not a fact. So do pay attention to the language they use. It's there for a reason, and it can throw you off, but it can actually give you clues as well. So think about, are these statements a certainty or a likelihood? And just remember, if nothing's explicitly stated in the text, don't answer based on any prior knowledge that you have. Just go with exactly what information you're given and answer according to that. So that's all we have today for talking about the decision-making section of the UCAT. So best of luck with all your practicing, and thank you so much for listening. Check out the description box below, and there'll be links to our ebook which will take you through all of the UCAT and your preparation for the day, and also a link to further resources, because as we said, practice questions are the best way that you'll learn and prepare.